Hello, everyone. Um, Welcome to our November Midday Science Cafe. We are so excited to have you here for Clearing the Air, Health Impacts of Indoor Air Pollution. And so here we are. We just heard a classic song, Smoke Gets in Your Eyes. So hopefully we can learn how to keep smoke from getting in our eyes. We're being joined here with Dr. Laura H. Kwong from UC Berkeley and Dr. Xiaochen Tang from Berkeley Lab. Just a few things before we get started. You can find closed captioning for the Midday Science Cafe in Zoom. Either it popped up automatically or it's in the 3 dots under More, but feel free to open those up and follow us as via text. This is being recorded and we will post this video to the Science at Cal YouTube channel and the Berkeley Lab YouTube channel, and we'll share that link with you all via email once it's posted. My name is Michelle Rodriguez, and I'm so happy to be with you here today. I'm Science at Cal's Interim Public Engagement Specialist. As we normally do with our Midday Science Cafes and all of our programming, we're going to start today with a land acknowledgement. We recognize that Berkeley sits on the Huchun territory, the ancestral and unceded land of the Ohlone people, the successors of the historic and sovereign Brona Band of Alameda County. This land was and continues to be of great importance to the Ohlone tribe and other familial descendants of the Verona Band. Every member of the Berkeley community has and continues to benefit from the use and occupation of this land since the institution's founding in 1868. By offering this land acknowledgement, the Berkeley community not only recognizes the history of the land on which we stand, but also recognizes that the Ohlone people are alive and flourishing members of the Berkeley and broader Bay Area communities today. And thank you for allowing me this time to give this land acknowledgement. In 2008, Science at Cal was envisioned as a unifying effort to raise public awareness, understanding, and appreciation of scientific research at Berkeley. To realize this vision, we engaged the vast Berkeley science, technology, engineering, and mathematics community, or STEM community, to foster creative collaborations among campus and community-based groups who share our commitment to equity and inclusion in STEM education and careers. Science at Cal connects researchers with diverse community groups of all ages and backgrounds for science engagement and learning. Accessibility, inclusiveness, creativity, and innovation are all hallmarks of Science at Cal events, which reach tens of thousands of people annually. Throughout the year, Science at Cal presents ongoing free outreach programs on and off campus, helps promote related efforts, and creates new programs and initiatives at Berkeley and in the community. This broad scope of activities is made possible by Science at Cal's dynamic network of campus alliances and valuable community partnerships. And before I hand things over to Berkeley Lab, who's one of our valuable partnerships, to say hello, I want to remind you that all of these events are always very interactive, and we expect a ton of Q&A. So add your questions into the chat or in the Q&A box. You don't need to put them in both, and we'll get to as many questions as we can. And now I'm going to hand things over to Jen Tang with Berkeley Lab.
Awesome. Thanks so much, Michelle. For those who don't know me, my name is Jen Tang, and I'm the Director of Community Relations at Lawrence Berkeley National Laboratory. And for those who might not know, Berkeley Lab is one of 17 U.S. Department of Energy national laboratories across the country. We are supported by the DOE's Office of Science, and we're managed by the University of California. All of the research we conduct at the lab is unclassified. And since our founding in 1931 by a UC Berkeley physics professor named Ernest Orlando Lawrence, we've been dedicated to advancing the scope of human knowledge and seeking answers to some of the greatest problems facing humankind. Today, Berkeley Lab employees work together to develop meaningful solutions to the world's most intractable energy and environmental challenges. They help train the next generation of scientists and engineers, and they ensure that those things happen in a manner that benefits everyone. Our main campus is located in the Berkeley Hills, and our close ties to the UC system create a really unique and synergistic environment for scientific discovery. A number of the lab's researchers are affiliated with one of the UC campuses, either as students, postdocs, or professors who might have a joint appointment to do research at the lab. And we're fortunate to have an especially close relationship with UC Berkeley, and our institutions have joined forces to advance science across a number of different frontiers. As you probably know, One of our main motivations for creating the Midday Science Cafe series is to share with you examples of compelling and complementary scientific research from both of our institutions. And we hope you enjoyed today's presentation on indoor air quality. Now, before I introduce our first speaker, I do want to share with you that this is going to be our last Midday Science Cafe talk of this series. As some of you might remember, Berkeley Lab and Science at Cal started this series at the beginning of the COVID pandemic as a way to keep our community up to date on the cutting edge research that was coming out of both of our institutions. It's been hugely successful thanks to you, to our dedicated audience. We really appreciate all of you for tuning in month after month. And we also really appreciate the researchers who we've featured since the spring of 2020. So I also want to say this as integral to the Midday Science Cafe program is Dee Rossiter, who is the Executive Director of Science at Cal. You might remember her from previous talks, and I want to ask her to join me on the screen right now just to say a few words.
Thanks, Jen. Yes, this is like a very bittersweet moment, I think, because, sweet in the only sense that the pandemic is behind us for the most part. Although get your seasonal booster shots, everyone. But sweet in so many ways because we've developed such an amazing partnership. And it was interesting because we host about 50 programs a year, lectures and festival events and everything in between. And this is our only one online, and it's sustained sort of this long standing, these over the years, it's really hasn't died down much. And I think a lot of other programs have died off a lot sooner than this one. So I'm really proud of what we've created. I also want to say, at the very beginning of the pandemic, and none of our scientists who were scheduled to, hit our stage wanted to do an online program. And now we have this really successful program that we haven't wanted to end. And then we get more emails, I swear to you, from our audience members about either asking about the content that they've seen, asking for more information, or just thanking us for how amazing our speakers have been. And I just want to say, I know some of you might be first timers and this is all whatever for you, but some of you might have been joining us over the years. And that's not an accident that our speakers are so good. We really work with our speakers. They put a ton of effort in practice sessions and making sure that their research and findings and presentations are accessible. And we work on the Q&A. And this is something that we've put a lot of energy and time into. And we want to thank all of our speakers. I know we'll both do a big thank you to all of our speakers throughout the years and also just to our audience members. So for those of you who have stuck around, thank you so much for being here. And I'm so happy. We have a lot more coming up in the new year, so stay tuned. Jen will probably say a little bit more about that.
Thanks, Dee. Yeah, so as Dee mentioned, we're sad to say goodbye to Midday Science Cafe, but we're excited to move back toward more in-person events. And so if you'd like to stay in the know as those programs come together, I'm going to drop a link in the chat in a couple minutes where you can sign up for Berkeley Lab's monthly community newsletter as well as Science at Cal's newsletter. So you can stay up to date with us there. And with that, it is now my pleasure to invite our first speaker to the screen, Dr. Xiaochen Tang. Xiaochen is a Principal Scientific Engineering Associate in the Indoor Environment Group of the Energy Technology area at Berkeley Lab. And her work focuses on understanding indoor chemical sources and reactions that affect indoor air quality and potentially harm human health. She focuses on characterizing performance of air cleaning technologies, such as air cleaners and photocatalytic materials. And she also evaluates novel cool building envelope materials in connection with the lab's Heat Island program. She's also a member of the Third Hand Smoker Research Consortium, which is a multi-institutional effort funded by the Tobacco-Related Disease Research Program. And that organization conducts studies on third-hand smoke and its human health effects. Before joining the lab in 2016, Xiaochen was a postdoctoral scholar at UC Berkeley, go Bears, and she studied the impact of human occupants on indoor air quality and chemistry. She actually has her PhD in chemical and environmental engineering from UC Riverside. In her spare time, Xiaochen likes to spend good quality time with her cat, Dodo. So Xiaochen, I'm going to hand things over to you.
Okay, thank you, Jen, for the introduction. And it's my honor to be one of the speakers at the last session of the Midday Science Cafe. Hi, everyone. My name is Xiaochen Tang. I work at the Indoor Environment Group at Lawrence Berkeley National Lab. Today, I'm going to talk about the environmental and health impacts of vaping. So what is vaping? So vaping is to use a device called waves, mods, or e-cigarette to convert the liquid with this device into aerosols that can be inhaled into human lungs. And the liquid used is called juice or e-liquid sometimes. And the vaping devices come in different shapes and configuration, but they all are composed of these elements, including the battery for to either rechargeable or one-time use, and a sensor, an atomizer, which heats the liquid held in these cartridges containing the e-liquid, and the substance can include nicotine, marijuana, or other chemicals. And vaping technology is pretty new and is very driven by innovation. So just in the last couple years, there has been an evolution of 4 generations of these devices using either disposable or refillable cartridges. So there are many reasons for people to start vaping or switch from smoking to vaping. Here are some examples. So some people believe it's reduced harm compared with regular tobacco smoking, or people just pick up vaping because of curiosity, or they think this is the trend or it's fashionable. And we have to mention that flavor is a big section of the experience with vaping, and it is very popular, especially among young people. So here we can see on the left-hand side, this is a survey done between 2011 and 2018 on the percentage of teenagers in the US who have used e-cigarettes in the past 30 days. So we can see there is a significant increase from 2011 to here, 2018. And by 2018, there's already 20% of high school students who have used e-cigarettes in the past 30 days. And here we can see in 2021, this survey suggested that among all the age groups, people aged 18 to 24 years old were most likely to use e-cigarettes among all adults. And within this age group, 40% of them have never been regular cigarette smokers. But we have to mention that according to recent surveys, there has been stabilization, or we can see a stop of increase in this trend. So maybe there is already changes being made to stop vaping among young people. So to answer the ultimate question, are e-cigarettes less harmful than cigarettes? The answer is yes, but that doesn't mean cigarettes are safe. There are a lot of harmful chemicals in the vaping aerosol, including nicotine and ultrafine particles, volatile organic chemicals, and a lot of cancer-causing chemicals. Other than the health damage done by inhaling these vaping aerosols, there are also environmental impacts from vaping, including biohazard from heavy metals and residual nicotine, as well as e-waste from using cartridges and pods. And in this talk, I'm going to just focus on health and air quality, not only because my research area is indoor air quality, but also in the US, people spend 90% time indoors. So it is important to know if you are in a safe environment. So let's see what's in the e-liquid and the vaping aerosol, because it's either from the e-liquid or the devices themselves. The composition of the e-liquid is 90% or more glycerin and propylene glycol. They're used as either base or solvents of the other substances. And there's about 2% of nicotine in the e-liquid. and a very small amount of flavoring ingredients, and some of which have already been banned by FDA in 2022 because of the health and safety issues related with flavoring ingredients. And these, you have seen in the last slide, that these harmful chemicals are produced while the e-liquid is heated to above 400 Fahrenheit inside the device. And because of the high temperature, a lot of chemical reactions occur and producing a lot of these toxic or carcinogenic chemicals. So here we want to talk about different pathways for the impact of human health and indoor air quality. So mainstream emission is what's being inhaled by the smokers, by the users here. And it's gonna only impacting the user. But when the vapor exhales, the non-users in the surrounding environment will also be impacted. And for the indoor environment, not only emissions from indoor vaping contribute to bad indoor air quality, but also the outdoor filtration from through like open windows, doors, ventilation systems, they also lead to bad indoor air quality. And this will also impact both users and non-users, and they suffer from bad air quality as well as the potential health impacts. So actually, vaping aerosol shares a lot of similarities with the regular tobacco smoke, and a lot of these compounds found in vaping aerosol, they're either carcinogenic or toxic. So here, benzene, it is a known carcinogen, and formaldehyde, acetaldehyde, glycidyl propylene oxide, these are possible carcinogens. And acrolein is toxic as well, and also a very strong irritant to skin, eyes, and respiratory system. The last compound shown here, diacetyl, is a fluorine ingredient, and it has been known to cause several respiratory issues. So we'd like to see what's the intake dose from vaping compared with the aerosol from combustion cigarettes. So here we show the estimated intake per day for these 4 chemicals compared with the intake dose range shown in these gray bars or gray areas for the combustion cigarettes. So we can see for this formaldehyde chemical, under different puffing regimes and these low, medium, and high emitting vaping devices, that the daily intake of formaldehyde is already higher from vaping than those from combustion cigarettes. Then how about the secondhand exposure? And here we look at 2 typical scenarios: a residential scenario with 1 vapor inside the house, and a social scenario where in the vaping bar you have multiple vapors. And here we look at the increased air concentration due to vaping in the indoor environment. And the red bar represents the acute safety threshold for these chemicals, and the blue and black bar represent the chronic safety threshold. So we can see in the residential scenario, there's barely any scenario the safety thresholds are exceeded. However, in the vaping bar scenario, we can see the chronic safety level has been exceeded for formaldehyde and acrolein, these 2 chemicals. And sometimes in the extreme cases, even the red, which is the acute safety level, was also exceeded, suggesting that in such indoor environments, you can be exposed to harmful indoor air quality. And because we already know that there are similar toxic chemicals in the vaping aerosol and tobacco smoke aerosol, however, we have to keep in mind that vaping aerosol has a lower level of these carcinogens. And there's already study on the health impacts or damages done to the human body from the vaping aerosol, but there are still a lot to be studied to see their long-term effects. And to look at the health impact from another perspective, we can separate them to immediate or long-term effects. And then we admit there are benefits from vaping. For example, they provide relaxation feeling, and in the long term, it can be a tool to help people quit smoking. However, there are a lot more damages can be done to human brain, especially to the developing adolescent brain, and it can cause a lot of respiratory systems, and also it can potentially lead to death due to lung damage. So here, I just want to introduce some recent study on the residual, what we call third-hand study on for vapor from e-cigarettes, and they have been shown to cause damage on mice lung. So in this study, researchers separate mice into 3 different groups, and for the first group, they were provided with a clean towel, and for the second and third group, they were provided with towels exposed to vaping aerosol containing either containing nicotine or without nicotine or with nicotine. And after 4 weeks, researchers look at their lungs, and then we can see for these for the second and third mice groups, there are larger air sacs and collagen found in their lungs compared with the control group exposed to the clean towel, which has a normal lung. And it means there's lung damage because these larger air sacs and collagen, they make it harder for the mice to breathe, and it increases their chance of getting lung cancer. So that means even exposing to the residual. So here now talking about first-hand or second-hand exposure. So this is the residual from these e-cigarette vaping aerosols. They are damaging the lung tissues. And as some of you might already know, there has been an increasing use of vaping with cannabis e-liquid. And here we are showing some differences between tobacco vaping and cannabis vaping. So of course, the active ingredient is different. Tobacco vaping is with nicotine, and for cannabis vaping, depending on the use, depending on the purpose, if it's entertainment or medical use, it's either THC or CBD. And there are different types of devices used, different solvents, and the flavoring is also different. And for cannabis vaping, there has been found some illegal additives that are already causing damages to human lungs. So the take-home message from my presentation today is we are seeing that vaping is less harmful than traditional tobacco smoking. However, they are not harmless. And so that means if you would like to have a good indoor air quality, and also for the consideration of health, we should treat vaping similar to smoking. So no indoor vaping as well. Thank you.
Awesome. Thanks so much for that presentation, Xiaochen. So we've got a few questions about your research, and the first question actually came in from one of our audience members. So can you talk about whether there's any reduction from drawing air through either like an N95 or N100 respirator? And also, would there be any reduction in indoor air quality or like improvement in indoor air quality if it was filtered through like a HEPA filter or, using like maybe a UV treatment unit?
Yeah, this is a great question. Using a mask or especially like an N95 mask is definitely helpful because it removes 95% or more of the ultrafine particles. And those, normally contain a lot of those semi-volatile toxics. And especially from tobacco smoking, we know that I think more than 90% of the damage actually come from inhaling those ultrafine particles. So similarly, if you use high efficiency filters in your home, that will definitely improve the indoor air quality, but you need to keep your windows closed, of course.
Right. Got it. That makes sense. All right. Thanks, Xiaochen. And then one more question. In your bio, I talked about how you're a member of the Third Hand Smoker Research Consortium. Can you talk a little bit about what third hand smoke is in relation to firsthand and secondhand smoke?
Sure, yeah. So in this presentation, we talk more about firsthand, which is the mainstream aerosol that is inhaled by the smoker or the vapor. And secondhand is what people can smell or inhale while there is a smoker in the room. But third-hand smoke is actually what lingers inside the room after the smoker has left, or it has been hours or even days and weeks after the smoking has ended. And for example, when you enter a hotel room, which is pretty old or, has a smoker has taken that place for some time, you notice that odor, and that's a sign of third-hand smoke.
Got it. Thanks. And so could you give us maybe another example of like third-hand exposure in like a family residence scenario with somebody vaping indoors?
Sure, yeah. So we actually have been doing some remediation work with environments contaminated with third-hand smoke. For example, carpets are very common indoor material in the US, and nicotine and other semi-volatiles from vaping aerosol or smoke aerosol, they just absorb onto those fibers and they stay there for weeks, months, and years. And for example, if you have a baby or a toddler who crawl on the carpet and they get their hands on the carpets, so there is thermal intake through the skin, and there could be also ingestion because they put their toys or their hands into their mouth. So that's additional health risks for children.
Got it. Thanks so much, Xiaochen. We've got a couple more questions for you, but we'll save those for the Q&A. So for now, thank you again for that great presentation. I'll have you stop sharing your screen, and I'm going to hand things over to Michelle to introduce our next speaker.
Thank you, Jen, and thank you, Xiaochen. That was really fascinating. I think I learned a lot. I was totally one of those people duped by the vaping industry thinking that they were totally safe. So here we go. So it is my pleasure to introduce Dr. Laura Kwong. She's an assistant professor in the Division of Environmental Health Sciences at the UC Berkeley School of Public Health. She focuses on environmental justice as it applies to environmental health in low-income countries, given the large disparities in health outcomes between high and low-income countries. An engineer by training, Dr. Kwong works with communities using human-centered design principles to develop engineering interventions to address public health issues in low-income countries, particularly issues related to infectious diseases and air pollution. She works with local research partners to conduct randomized controlled randomized controlled trials, that's a mouthful, to evaluate these interventions using qualitative and quantitative methods. Dr. Kwong has conducted community-based participatory research in Bangladesh, Uganda, Indonesia, China, Mongolia, and Mali. Dr. Kwong received a PhD in civil and environmental engineering at Stanford University, and prior to her time at Stanford, Dr. Kwong worked on water security and national water quality standards as an ORISE, or Oak Ridge Institute for Science and Education fellow at the U.S. Environmental Protection Agency. Laura, it is my pleasure to turn the stage over to you.
All right, great. Thanks so much. I'm very happy to speak to everybody. My internet is a little bit weak today, so please holler if things are not going well. Yeah, happy to speak to everybody today. So as mentioned, I'm an assistant professor at UC Berkeley in the School of Public Health, and I run the Global Environmental Health Equity Lab. My lab's research is focused on advancing environmental justice through solutions-focused research in partnership with communities. So I've worked on everything from, reducing air pollution through providing better insulation in traditional Mongolian homes, creating additional ventilation in low-income Bengali homes, working on container-based sanitation, which is used in areas where there isn't enough water, or it's too difficult to use water for a sewer-based system. And instead, it's kind of like poop in a bucket, but that waste can then also be reused rather than just flushed away. I've also worked on child development and children's exposure to fecal matter in rural Bangladesh. And I worked on exposure to intestinal worms, both in Uganda and in Tibet, and really thinking about how can we work together with communities using the knowledge they already have, supporting that with additional expertise and some resources to improve their lives, but, working within the systems that they already have and something that is a sustainable solution for them. So I worked mostly in Bangladesh for about 10 years. And Bangladesh is a small country in South Asia. It's about the size of Iowa, but it has about 1/2 of the United States population, right? So it's extremely dense. You can also see that it's a river delta, and about a quarter of it floods every year. So very, very, very dense area. And I've developed a really strong partnership with the International Center for Diarrheal Disease Research, Bangladesh. And they are a hospital that serves any patient who has diarrhea who walks in the door for free. And so they're a very respected research institution, and people are really happy to participate in studies that this hospital runs. And so because I was working for them for probably about 7 years, when the Rohingya people fled from Myanmar into Bangladesh, as someone in engineering and public health, I said, there's got to be something. There's got to be something that I can do to help contribute, more information to this situation to help make life easier, either now or in the future, for people in this difficult situation. So what we did is we were really interested in evaluating this program that provided liquefied petroleum gas to 1 million people, the entirety of the Rohingya refugee camp. It's really unusual to provide cooking fuel in refugee camps, but it was really essential in this case. And so we saw an opportunity to evaluate this program to help better understand its impacts on both human health and the environment. And so the first thing that we did is we went to embassies who were the primary donors for organizations like United States High Commission for Refugees, right, UNHCR, and the International Organization for Migration. And so we said to these donors, like, what kind of information would be useful for you to decide whether or not you were going to continue to fund this research, right? So I really try to be policy focused and policy relevant in my research. It's not just things I think are interesting, it's things that I think are interesting that somebody is actually hopefully waiting for this information to help them make a decision. So when we talked to these donors, we heard they were really interested in a broad range of potential impacts, right? What's the impact on deforestation? What's the impact on gender-based violence? What's the impact on respiratory health? And so I'll show you this video and you'll see that it's much more comprehensive than most research is, because we tried to look at all of these different outcomes. We were interested in it, and we also knew it was influential for donors. So because probably not very many people here have been to a humanitarian setting or have been to this particular humanitarian setting. I wanted to show you a video to sort of really take you to the place where we're working, give you a sense of what that place is like, and then walk you through the research that we did and our results.
And Layla, this is Jen. Before you start your video, we're still
Yeah.
seeing some boxes on your screen. So I'm wondering if those...
I am not seeing any boxes on my screen. So
I'm
that
now
makes it
seeing
hard. Where is the
3.
box?
Upper right, lower left, and lower right.
A lot of boxes.
Yeah.
I didn't do anything different than I did before.
I'm wondering if maybe I can have you stop sharing your slides and then reshare them.
Okay, I can try that. Is that any better?
No, I'm still seeing boxes. Now across the top of your
Is
screen.
that just one box?
I'm seeing 3. One on the lower right. I think you just moved one to the bottom of your screen. Yeah, I'm seeing whatever you're moving around.
Well, I only have one box that I can see. And
Okay.
that's
Oh.
the only box that I can say disappear, but it's not disappearing.
No.
All right, we'll try one more thing.
Okay.
One
we'll
just
just go for it.
disappeared, but there's still 2 left.
Yeah, they are not on my screen, so I cannot tell you what's happening. All right, how about now?
They're more off to the side. So if they're going to exist, oh, now it's just down to 1. So that's good. I say we are, oh, now there's something just popped up. So now that's in them. Okay, we're down to 1. So I say we go with it.
All right.
Meet Fatima, a Rohingya woman living in a refugee camp in southern Bangladesh. She's starting her liquefied petroleum gas stove to cook dinner for her family. She's happy that she can quickly and conveniently cook for her family. Today, nearly 1 million people in the Rohingya refugee camp cook with liquefied petroleum gas, or LPG. It wasn't always like this. When 700,000 Rohingya first fled from Myanmar to Bangladesh in 2017, they were provided with shelter and food, but no cooking fuel.
Ara bormote ever for a tune, Ara head dome at the there, Ara to Rasan Katajan Loy, Tel, Dial, Morish, Russian, Fias, Therefore a shop gym of the Bekin Aratun, Sajonasi.
Aratin Kambataver for a tin. Radamaraloi Bishi, the Hodidan Bishi Hosta. At a line, Aratin Basitaval line. Plastic one for a in Fourier and Adamarabore. The day Aratin, Plastic Nahadile. Aratin Murazan for a Muratel Hadianan for a.
Lacking other options for cooking fuel, refugees turned to the surrounding forest for firewood, just as many local communities do.
বর্তমানে যে পরিমাণে আমাদের বনভূমি এবং বনজ সম্পদের উপর ক্ষতি করছে সেটা পূরণ করতে 10 ইয়ার্স থেকে বেশি লাগবে। এখন যেহেতু মানুষ বেড়ে গেছে, এখানে বন্যপ্রাণীগুলো আস্তে আস্তে দূরে সরে যাচ্ছে, তাদের খাদ্যের যে ব্যাপার সেটাও কমে যাচ্ছে।
The loss of forest had indirect effects too. Scarcity of resources created tension between refugees and host communities. And the denuded landscape altered the migration pattern of endangered Asian elephants. To address these negative impacts, the government of Bangladesh, together with the humanitarian community, including UN agencies, local and international NGOs, and private sector partners, began to provide LPG stoves and cylinders, regular refills, and training to every household in the camp, starting in 2018. An independent team of researchers from Stanford and ICDDRB evaluated the project, one of the largest distributions of cooking fuel in the history of humanitarian settings. They conducted 1,400 household surveys, 108 in-depth interviews, and 52 focus group discussions. They placed air pollution and stove sensors in 182 houses over 3 years. Here's what they found. Providing LPG for cooking has resulted in multi-sectoral benefits, substantially reducing deforestation and improving mental and physical health and well-being.
Gas فبرابطو فواساتو عزمتو مرزاوتو دروانولا هم عزمه فواساتو مرزانا فرير عزمه هزبريت فرير تنكم غريت فرير عارفو اسكول زي فرير فراشو جوك فر.
The LPG distribution program allowed households to switch from using 4.3 kilograms of firewood per day to using 0.34 kilograms of LPG per day. In this way, the program prevented the extraction of 330,600 tons of firewood from around 6,000 hectares of forest per year and avoided the emission of 407,000 tons of carbon dioxide. Families reduced their monthly spending on firewood and increased their spending on food. Families also experienced less air pollution, averting respiratory illness that reduced 385 child deaths and 2,309 adult deaths.
Algor gan detto laggo bajdi gor gan bandi showroom kakan janala ase suamaze darwadi lahorudi banan dahore dua iragor gan andar ho jabe.
According to local interviews, the change from cooking with firewood to cooking with liquefied petroleum gas also reduced the occurrence of domestic violence. When men came back from the forest, late or without firewood, they would sometimes argue with their wives out of frustration and fatigue. Husbands would sometimes also yell at their wives for taking too long to cook, not watching the children closely while she cooked, or creating smoke that polluted the air and soiled clothes. Tension with host communities over natural resources also decreased. Parents reported that they spent less time cooking and cleaning and more time supporting their children, resting, socializing, gardening, learning skills and volunteering. Children also had more time to study.
Gas tu dargwaloy ulla faraloy randa bara guttam sulada hatulurine vittam. কিন্তু এখন গ্যাস পাই রান্ধা বাড়া গরিবার সময় মাঝে হুয়ান্দির সময় লিভারে অন্য হাসো গরিভারে অন্য রুজু সাহানো করে.
Providing LPG has helped reduce deaths and disease due to indoor air pollution, increase carbon storage and improve food security, personal security and general well-being. It has also reduced tensions between Rohingya refugees and host communities. To provide these benefits, humanitarian donors spend between 33 to 47 cents per household per day. The Rohingya camp is one of the few humanitarian settings in the world where cooking fuel is provided. Globally, 1 in every 100 people has been forcibly displaced from their homes due to war, natural disasters, and climate change. Providing clean cooking fuel in other humanitarian settings could increase the number of refugees who benefit directly while reducing deforestation, which benefits us all. Fatima wonders how long she will continue to be able to receive LPG and escape from the hardship, violence and health problems she faced when using firewood. The need for continued LPG provision is essential.
So we were really happy with the results of this work. We didn't go in it knowing the results, but we knew that we would find really meaningful results because in this setting where most people were using the clean fuel that was provided, it's quite different than other study settings where it's really hard to get people to use the clean fuel exclusively. And so with these results, we were able to share them with our humanitarian partners, and they were able to share them back to the donors and told us that, you know, this research, its results, things like this documentary were really helpful in attracting additional funding to continue this distribution of clean cooking fuel for almost 1 million refugees. And so it's been exciting to see how this research was able to evolve and then create some of that impact that will have benefits for both humans and the environment. And we're also interested in how programs like this could be rolled out in other humanitarian settings. There's a lot of barriers to that. Of course, it's expensive to provide this kind of fuel, but there are many, many benefits too. And so we hope by helping elucidate those benefits and sharing them with other people that donors will continue to support these types of programs. So I'm happy to take any questions that anyone has, and I know we'll have more questions together at the end.
Awesome. Thank you, Laura, so much. That's really fascinating work and really like meaningful work. And the documentary really demonstrates the importance of providing cooking fuel as it's like humanitarian need. It seems so obvious, but it wasn't before you started the research. And so that's really exciting. The video mentioned some of the research team's work, like the household surveys, the in-depth interviews, the focus group discussions, and also all of the air quality pollution sensor placements. What was that research? Can you paint us a picture too of like the research process?
Sure. So good thing I had some extra slides for you. So it was a difference in differences study, which means that one group has the intervention and the other group doesn't have the intervention. That's usually what it means. This was a little bit interesting in that one group actually had the intervention at the start. They were in the camps run by UNHCR, and they had already been using LPG for 12 months before we started the study. The other group, they didn't have the LPG yet, and they were about to get it. And so we measured them at baseline, right? Some people already had it, some people didn't. And then those people that didn't have it got it. We measured them at midline when everybody had it, and at endline when everybody had it. And we did qualitative data, household surveys, sensor measurements, and deforestation modeling. And so we pulled these camps, we pulled the households from throughout the camp. Again, you can't really tell the size here, but there's this bar that says this is 1 kilometer. There's about 800,000 people living in here, right? So it is extraordinarily dense, as you could see in that movie. Our staff were from the local university. They speak Chittagonian, which is said to be a dialect of Bengali, but actually is not mutually intelligible. But it is very, very similar to the language spoken by the refugees. And so it's really key to have these women from the local university. We did household surveys. We did in-depth interviews. And we also did these focus group discussions, asking questions about sort of people's perceptions of security and violence, and how did it feel to go collect firewood and things like that. We also did monitor the stoves. We monitored both the traditional stoves and the new stoves to assess their temperature, and use that to understand how much the stove was on each day, right? Were people really just using the new clean fuel, or were they still using firewood sometimes? And then we measured air pollution. Most of these are one-room houses. Sometimes the kitchen has like a little barrier to it, but the air pollution sensors helped us measure PM 2.5 that household members would be exposed to. Yeah, those were mostly the methods that we relied on, and we aggregated them to figure out all those results that we shared.
That's great. That's so robust, right? There's so much that went into this. It's really awesome. A question from the audience. Can you talk more about the CO2 generation and reduction for the LPG versus local wood fuel versus electric cooking options that may have been considered?
Yeah, so unfortunately, electric cooking is not possible in this camp. There are some new solar stoves. One is called the Ecoca, which people are currently evaluating for humanitarian settings. But cooking takes a lot of power, right? And so to draw that from solar is really difficult. And people are not connected to the national electrical grid, and there aren't decentralized electrical grids in this area. Refugee camps are supposed to be, host countries want them to be sort of temporary. And so they're very not excited to connect them to, national infrastructure like the electric grid, and therefore electric-based cooking wasn't available here. So when we think about the CO2 versus for the clean fuel versus deforestation, yes, LPG is from a fossil fuel, right? It is not a renewable resource. It's not from hydro. It is not solar. There is still emissions from burning, right? Those carbon-based sources, but it's a lot less than burning biomass because it's much, much more efficient, right? The energy transfer that from the gas going directly into the pot is much more efficient than traditional stoves, where a lot of heat is escaping. And so that's where we see the benefit in reduced CO2.
Great. Thank you so much.
Mhm.
Thank you. I'm going to turn it over to Jen to kick us off for our official Q&A. And so at this point, I'd love to invite Jen and Xiaochen back to the screen. And there you guys both are. Jen, take it away.
Thanks, Michelle. So we did have one question come in for Xiaochen over the chat. So this is about the efficacy of ozone generators. Can you, and maybe both of you can answer this question, but could you talk about how effective the use of ozone generators are to get rid of smoke indoors? Do they remove the smell only? Are they removing particulate? And how do they compare to HEPA filtration without the UV component?
Yeah, sure. So actually, we have done some study using ozone generators in our lab, and we have to say there has been a long history of using ozone generators in different industries, right? Hotels, car rental services, and it is pretty efficient to remove odor. I mean, not only from smoking, but also fire, mold, and etc. And what we found from our study is that ozone, indoors, it removes the airborne nicotine, which means you reduce the nicotine concentration in the air after using those ozone generators. And also a small fraction of those nicotine that are on indoor surfaces. So we used some fabrics, and also we took those heavily contaminated carpets from smokers' homes and placed in one of our environmental chambers and test. So we did see some reduction, but again, like after turning off the ozone generator and let the carpets equilibrate with the air for a few days, you see the same level. That means for those heavily contaminated environments with these fabrics with they serve as the reservoir and the source for all these chemicals to re-emit from inside. So from that perspective, just using the ozone generators a few times, it won't help in the long term.
Got it. Interesting. Thanks, Xiaochen. Laura, do you want to add anything to that? Okay. Well, I have
not in my wheelhouse.
Okay. I've got a question for you both then. So, Xiaochen, you talked about the impacts of vaping. Laura, you talked about the impacts of cooking. Are there other indoor chemical sources that affect, indoor air quality that our audience should be aware of?
In my setting, we were really interested in that burning of plastics. And that's not something you would typically, be concerned about in, an urban US home. Sometimes in rural areas, people still burn trash and just like a barrel fire or something like that. But it was very hard to find any research on that, which is sort of good because it means that not enough people are doing it, that people think it's a problem that they need to study. But I also think that this is an equity issue where some people are forced to use these very, very sort of not even substandard, just materials that should not be used for cooking, and yet they are still burning them, right? And we know at landfills and, in rural areas just to get rid of trash in other countries, I've seen people just, burn, plastics and wrappers and things like that. And so I think I would really like to see more research on sort of what is going up into the air and what potential effects that has.
Thank you. Xiaochen?
Yeah, so actually some colleagues in our group are studying cooking emissions and the impact on indoor air quality. I mean, even in modern homes, people sometimes are not using their, their ventilation, or they're just not ventilating their kitchen properly or enough. So it is important to understand that there are a lot of particles generated from cooking, the fuels, and also just by heating food at high temperature. And those ultrafine particles, they can also be inhaled into lungs. And due to the high temperature, there could be, toxic or harmful chemicals.
Got it. Thanks, Xiaochen. I remember when I first started working at the lab, reading about that research, and ever since then, I've turned on my fume hood when I cook using the stovetop. So thanks for that.
Right.
Let me hand things over to Michelle to ask a couple questions.
Thanks, Jen. Laura, I have a couple questions for you. One of the things, since we're talking about cooking, that you'd mentioned was the fact that in your study, in your situation in this particular refugee camp, everyone sort of needed to use the natural gas stoves because because there just wasn't enough wood fuel around. But then in other settings, that's not necessarily the case. What barriers do you know of that would keep other people in other situations to continue to use the wood stoves? What might be going on there? Does that make sense? Oh, but you're muted.
Sorry, what barriers to using wood, or what barriers to using the clean fuel?
What barriers are there to change their behavior in the way that they're cooking food?
Well, habits are habits, right? Behavior change is hard. I tell you, I still promise myself every New Year's that I'm going to floss every single day, and it still does not happen. And that's been on my New Year's resolution for probably 5 years. So, right. We don't always do things that we know are healthy, we know are better. Habits are hard to break. Affordability, though, is the primary difficulty. I have a colleague at UC Berkeley, Annalise Gilwellen, who's looked at affordability of clean fuels. And, people have to pay a lot of money, maybe 14-20% of their total household income on clean fuels. That's just not sustainable, right? When we think about what is affordable for utilities in the United States, we think about less than 5% of your income going to, gas, electric, water, trash, like all of that stuff. And so when you're low income, right, you gotta buy the food first. You can't buy the cooking fuel. And so when you have low cost fuels nearby, you're just more likely to use those, right? And so sometimes biomass is expensive, right? Charcoal is actually quite expensive, but you can, over the whole year might be more expensive than clean fuel, but you can buy it in tiny packages. You can buy a little bit of charcoal every day, whereas you have to buy a whole gas cylinder. And so that might work for the finances of a low income household more easily. And then, just a lot of fuel can also be gathered for free, right? If you're sweeping up leaves or, going out to a forest that nobody maintains, then you can continue to use that fuel for free. So you might use your clean fuel for quick things, snacks, boiling things, but you might continue to use wood for beans or rice or things that take a long time. And so, just hard barriers to get over. But there is a lot of work thinking about financing and thinking about how to make these more affordable and more accessible.
Yeah, it seems clearly there's a financial incentive here, right, for people who fund. So if you're out there and you fund things like this, fund natural gas situations like this. Thank you. Xiaochen, there's sort of a similar behavioral component, I guess, right, to vaping or cigarette smoke. In your work, do you do any, is your work primarily focused on what the effects are scientifically, or are you also working at all in like how to change behaviors, or is there that kind of work around?
Yeah, we actually focus on chemistry and also remediation of third-hand smoke, and also study like vaping aerosols. But so I'm not the expert to ask about these, and I definitely don't want to mislead people.
Yeah. I just read earlier this morning that Snoop is apparently stopping smoking, so maybe there's something there. All right, wonderful. Now, Laura, aside from the very quite apparent funding need to support LPG distribution, are there other research questions being asked, either in this particular refugee camp or in other similar camps, around what other kind of humanitarian needs there might be in these situations?
Yeah, so not thinking about air particularly, but more about just research in humanitarian settings. It's really hard, right? It's really hard because people are going from a crisis mode to a protracted, difficult situation mode. And of course, there are a lot of people dealing with trauma, right? Refugees are fleeing from an area for a reason, whether it's economic or, political violence, things like that. And so some really important research that is happening and sort of needs to be expanded is research on mental health. And how can we deliver mental health sort of treatments to large populations with sort of a low skill starting base, right? How many psychologists exist in this area, right? Very few. How many trained individuals speak this language, right? And so how can you draw from the local population, from the population that really understands the trauma that has occurred, and give them some types of basic training so that they can, work effectively with their fellow community members to help reduce some of that trauma, because it's really, really hard to, you can't just get over it by yourself, right? Really, really difficult things have happened. And then, of course, there's a political problem, right? These Rohingya refugees are actually not allowed to work in Bangladesh. Bangladesh doesn't want to give them a Bangladeshi education. I'm not commenting either way on what I think about that, just stating that that is the case. And so this is really humanitarian situations all over the world are a really big issue of like, what's the sustainable solution here, right? It's not living in a refugee camp long term, but oftentimes the places they came from are not safe places to go back. And so to me, I think can we prevent these things, right? Can we be respectful and accepting of differences that we have in the world and not push people to the brink and sort of avoiding those. So yeah, lots of research on health, lots of research on air, lots of research on mental health. And also I think on the political side of just how can we avoid these issues to start with. And I'll just add that one major displacement is also climate change. Right. A lot of people are being forced off their land because they can no longer farm there. It's too hot. It's too dry. Right. The land got marginalized. And so the crops that used to grow there can't grow there anymore. What are people going to do? And so that is causing a lot of displacement of people moving to the city, taking very, low skilled jobs and things like that. And so just one more reason, that we need to work on climate change is because it's increasing these humanitarian disasters.
That's a really great point. Jen, I'm going to pass it over to you. Thank you.
Definitely. And thanks for that great answer, Laura. So I'm going to use my co-host privileges to ask a question. There may be some folks in the audience, myself included, who remember when it was okay to smoke inside restaurants or airplanes or other public spaces. And I'm curious to know how the understanding of first, second, and third-hand smoke has evolved over the years, Xiaochen. And what changes do you anticipate maybe for the future of these kinds of impacts in your research?
Sure. So the research on tobacco smoke definitely started with the health concerns with smokers. And then not long after, people realized, okay, secondhand exposure is also very common. I mean, it was very common, and also it poses a lot of potential damages to human health. But then I would say, especially recent years, because of all those decades of research on firsthand and secondhand smoke and exposure, now the focus shifted more to third-hand smoke and remediation of those third-hand smoke contaminated environments, as well as the focus on raising public awareness, and also what's the scientific need for policy making, right? And another challenge for studying firsthand and secondhand smoke is the developing of new tobacco products and technologies, right, as well as cannabis smoking and vaping. So there's a lot of difference between cannabis smoking and tobacco smoking. So people need to start from the beginning, also applying very similar method with more advanced technology compared with decades ago to study the chemistry and also health impact of cannabis smoking. And by understanding their chemistry, then people can do in vitro and in vivo study of their health impacts on the smokers.
Got it. Thanks, Xiaochen. So I have one last question for both of you, because we oftentimes have students joining us in these talks. We're curious to know how you got started in this work. Can you talk a little bit more with us about what your research backgrounds were, how you got interested, and what you might have in terms of advice for people who are interested in pursuing a similar career path? And maybe Laura, we'll start with you.
Okay. Well, I wanted to be a medical doctor, and I volunteered at the ER, and that was really informative. So I would say, first of all, try something before you dive all the way and commit all your eggs to one basket, right? And so I worked in the ER for about a year, and I was like, oh, this is not what I like at all. Right? I really thought, I was pretty disappointed with what I saw in the US medical system and how we let people get really, really sick and broken before we, try to fix them up. I mean, of course, in the ER, you also see accidents, right? That just happen to happen, but you also see people that have not had good health care, right, for the entire time, not have a lot of preventative medicine or preventative health behaviors in their life, and then end in the ER. And I was like, oh, I don't really want to be part of that system. I want to work on more of the preventative side. Oh, that's public health. Okay. And then I really have always loved the environment. And I didn't even know there was a thing called environmental health, but I told my doctor friends, I said, you get them out of the hospital and I'll provide a nice environment for them. And so that's what I've worked on since then. I was also very privileged to be able to travel to other countries where, I just saw really degraded environments and people living in those environments. And I really, took it to heart that people shouldn't have to live scooping up water from a river that has, a truck dumping trash into it, right? And so I thought, what can I do to contribute that? So my undergrad was in chemistry and biology, but I really, really wanted to do anthropology, but my dad wouldn't let me. So I did a minor in anthropology, but I try to bring those elements of sort of mixed methods, doing qualitative research, quantitative research into my research now. And my focus is just on how can I increase, right, environmental justice. If you're working with populations that, for whatever reason, oftentimes colonialism, right, oftentimes maybe being taken advantage by their government because they're marginalized populations, what can we do to help these communities move forward and live in a healthier environment by working with them to develop these sustainable solutions. So I also took some classes in design and human-centered design, system thinking, to really think holistically about problems, and also what does the person need to actually work on the solution. So I love, policy work, and I've done some of that too, but I often find that, working at the household level and working with people is also impactful in the communities where I work in, where sometimes there's weak governance, right? And the government can make a law, but if nobody's enforcing it, right, then it's not that effective. So sometimes there's great laws and there's great enforcement, but sometimes that's quite difficult. And so I think also learning about human behavior and how to work with people too can also be really helpful. So I guess my advice for students is do something you're passionate about and just do it well, right? It's not going to lead you on a wrong track as long as you really do it well. Even if you do a few different things here and there, it'll all come together if you just put a lot of effort into it and think smart and really network too. Network and accept that you're not going to be the expert at everything, right? But there's a lot of experts out there, and you can work with them to come up with projects that are really good and look at multiple aspects of a problem and work to address those multiple aspects at the same time.
Awesome. That's great advice, Laura. Thanks so much. And I love the sort of interdisciplinary nature of what you've studied. That's really inspiring to hear that there are multiple pathways to get to sort of where you are. Thank you. Yeah, Xiaochen, we'd love to hear from you as well.
Sure. Yeah, I totally agree with Laura. Do something you're passionate about. I mean, I was in medical school for 1 year actually before I changed my major to environmental engineering. Yeah, I just learned that, okay, I have an engineering mind, not a doctor's mind. So, and I love solving problems. That's why I chose environmental engineering. And in that major, we learn a little bit of everything. And then when I came to the US for my graduate school, I found like, okay, air quality is very interesting because you work with trace amounts of chemicals, and they make like a great impact on the climate, air quality, and human health. And then after I completed my PhD on atmospheric chemistry, then I came to Berkeley and work on indoor air quality, which is totally different. But I found it very exciting because it's like one step closer to what I can change, or more like, in my sense, more practical compared with the atmospheric environment. So yeah, so then it was like more than 10 years ago that I started my research on indoor air quality. And I was really excited to be in the Third Hand Smoke Consortium. And because, it has been like a very big environmental issue, especially in developing countries, because I grew up in China, and even though my parents, they don't smoke, but I have so many family members who smoke. And even now, when I go back to visit, there are a lot of indoor smoking happening as well. So I feel like even though here in the US, we are already past the phase that, okay, ban the indoor smoking, etc. We are already doing a more advanced work. But I think all these research will be beneficial to other countries for their policy making. And overall, I think this is like good for humans. So, compared with doctors, they treat you, they help you get healthier. But like from my work, I'm also helping, yeah, from the engineering way.
Definitely. So many different ways to address problems. And again, that holistic nature is really, really incredible. Well, I just want to say thank you so much, Laura and Xiaochen, for those fantastic presentations. And again, just a huge heartfelt thank you to our audience for showing up over these last few years, asking great questions. And I also just want to bring up the full Midday Science Cafe team. So I'm going to ask Dee and Jocelyn Delgado, my colleague on the lab side, to join us again, just to say thank you for making this such just a fun program in the middle of a pandemic when we were all unsure about what was going on. I could trust that there was always going to be interesting work to be done with the team. So thank you to everybody so much. We really appreciate you sticking with us. As always, you can stay up to date on research coming out of both of our institutions at science@cal.berkeley.edu and lbl.gov. Thank you so much, and we'll see you in whatever our next iteration is. Thanks all.
Thank you, everybody.
Bye.